Welcome, everybody. My name is Alexandra Vacru. I'm the Executive Director of the Davis Center for Russian Eurasian Studies. And as we all know, Russia's war in Ukraine has had tremendous impacts across all kinds of different sectors, all sorts of different kinds of social services. And of course, the medical infrastructure has not been immune from being attacked and even targeted. Our panelists today represent an innovative way of dealing with this crisis, of dealing with these problems, and also represent the capacity of different organizations to come together and do something wonderful. What we have here is a rather unique combination, an exchange that was coordinated by Harvard's Scholars at Risk program, which Jane is going to talk about in a second, the Heal Ukraine group, which is Mark's effort, and also the Global Medical Knowledge Alliance. Our guests are going to describe exactly how this, is it HUG-Harvard SAR initiative came together and the doctors' specific targeted training and how they plan to support their specialties when they go back to Ukraine. I think I'm going to turn it over to Jane.
On behalf of all participating in this event, I'd like to thank the Davis Center for Russian and Eurasian Studies for their generous support and sponsorship of the event and the reception that will follow. I would also like to thank the Harvard Ukrainian Research Institute for their sponsorship of this event. I thank the offices of the President and Provost for their continuing support of the Scholars at Risk program. And on behalf of the program, I thank the many staff members at Harvard University who go beyond their regular duties to make it possible for the Scholars at Risk program to function and for its fellows and observers and their families to thrive. Now in its 22nd year, the Scholars at Risk program, a member of the National Scholars at Risk Network, is a fellowships program for at-risk and persecuted scholars, artists, and writers. The Ukrainian medical professionals you are about to meet are here as observers through a collaboration between this program and the Heal Ukraine group, Global Medical Knowledge Alliance, Massachusetts General Hospital, Brigham and Women's Hospital, and the Emergency Medicine Fellowships Program at Beth Israel Deaconess Medical Center. In an op-ed published on February 24th in The Hill, co-founders of the Heal Ukraine group, Drs. Jacqueline Hart, Mark Poznansky, Nelna Melnichuk, and Sergei Melnichuk, drew on remarks given to Time magazine by Oleksandra Matvichuk, human rights defender, lawyer, director of the Center for Civil Liberties, and winner of the Nobel Peace Prize. To Time, Oleksandra said, quote, "We are in the forefront of the battle between autocracy and democracy in this world. We are fighting for our right to have a democratic choice. And Putin, this work has not only a military but a value dimension. That's why it's not only the war between two states, it's a war between two systems, authoritarianism and democracy. Russia cannot continue to act with impunity," end quote. In their op-ed, the doctors agreed, urging that, quote, "Like untreated disease, repeated Russian aggression designed to wipe out the identity of Ukrainians and other national, ethnic, racial, and religious groups in whole or in part, and to alter international order will persist, fester, and continue to metastasize. Similarly, medical practice teaches us that treatment delayed is often treatment denied. In other words, leaving disease to inflame and intensify can ultimately render any intervention ineffective," end quote. There is an additional parallel to be drawn here, for which Oleksandra Matvichuk has so powerfully and effectively advocated the need to prosecute war crimes now, during the war, not to wait, and the need to rebuild the Ukrainian healthcare system now. On March 17th, the ICC issued an arrest warrant for Vladimir Putin, a move to charge a war criminal in the midst of war for crimes against humanity. According to Physicians for Human Rights, there were over 700 attacks on Ukraine's healthcare system during Russia's invasion in 2022. There were 292 documented attacks that damaged or destroyed 218 hospitals and clinics. Many health facilities were attacked more than once. And it is now 3 months later. And so, in the spirit of not waiting until the war has ended before making again what has been in the war destroyed, this collaboration resulting in short-term training observerships for Ukrainian medical professionals has been formed, a commitment to bring training, expertise, innovation, and new networks of support back to Ukraine so that the rebuilding can happen before it's too late. In other words, now. Informed by an all-Ukrainian scientific advisory board, this is an initiative that we intend, and we do need support for this, to continue for as long as necessary into the future. It's my honor to introduce Ukrainian Nobel Peace Laureate Oleksandr Matvichuk with recorded remarks to open our discussion.
My name is Oleksandra Matvichuk. I am Ukrainian human rights lawyer, head of the Center for Civil Liberties. We have been documenting war crimes in this war, which Russia started against Ukraine in 2014. Russian large-scale invasion resulted in numerous deaths, injuries, and total destruction. Ukrainian medical system faced with an enormous challenge. For one side, we document how Russian troops deliberately shelling hospitals and attack medical workers while they are providing professional medical assistance. For another side, Ukrainian medical system has to operate healthcare functions in circumstances when a lot of doctors are in the forefront. A lot of people who moved from the occupied territories applied for help. Generally, Ukrainian population become more vulnerable to different diseases because of the constant stress. And very often, medical personnel have to operate their duties without electricity and light. Ukrainian medical system needs international assistance to be able to solve this challenge. It's extremely important. It's one of the key elements of the resilience of Ukrainian people in this dramatic time of our history.
Thank you, Oleksandra. I'm pleased to introduce our moderators and turn the conversation over to them. Nelia Melnichuk, MD, is a colorectal surgeon at the Brigham and Women's Hospital, assistant professor at Harvard Medical School, co-founder and CEO of Global Medical Knowledge Alliance, a nonprofit organization with the mission to improve medical care in Ukraine, and a member of the Heal Ukraine group. Mark Poznansky, MD, is director of the Vaccine and Immunotherapy Center at Massachusetts General Hospital, professor of medicine at Harvard Medical School, attending physician, infectious diseases medicine at Massachusetts General Hospital, and a member of the Heal Ukraine group.
Well, I'll start things off just by saying thank you to Jane DeLauren for making this possible, and I mean making it possible from the very beginning. One of the kind of starting stories was driving into work on February the 28th, 2022, last year, and going by the Museum for the Massachusetts General Hospital. And for the first time ever, I saw large illuminated signs in the windows saying Mass General stands with the people of Ukraine. That's quite a remarkable moment, frankly. I've been at Mass General for 25 years, never seen any statement of solidarity in that museum to anything other than the healthcare of the world. And at the same time, an email went round from the head of the hospital, which included quotes from my distinguished colleague, Dr. Nelia Melnichuk, and her husband, Sergei Melnichuk, and some other Ukrainian-American physicians who I work with at Mass General, stating what the war now meant to them and the consequences for the Ukrainian people, all in stark terms. Interestingly, when I contacted several of the people who were quoted, none of them were aware of each other than obviously Nelia and Sergei. But I saw an opportunity in a medical sense, similar to the op-ed, to act now, which is very much a saying of its time from the 1980s and 1990s in medicine, which was rather than to wait and act, was actually to act at that very time. And so we co-founded, Dr. Jackie Hart, myself, Dr. Nelia Melnichuk, Dr. Sergei Melnichuk, co-founded essentially a network of physicians in Harvard-affiliated hospitals with the mission of providing medical relief to Ukrainian healthcare workers directly in an accountable way, which Nelia has done so amazingly with her organization, and also to provide and support educational opportunities for Ukrainian healthcare workers. So that was really the mission, and like a lot of good groups, when you have a really good mission, it works. And we've stuck to our mission, and I think we've delivered on it, and we intend to deliver on it exactly as Jane says, until it's no longer needed. I'm just going to bookend my comments before introducing Dr. Melnichuk with a couple of talks that I attended last week, because in the American news cycle, and you can tell I've got a thick Boston accent, the news cycle is so fast that the war in Ukraine can seem like something that's actually over and has been over for months. And of course it isn't over. It's probably not even just, as they say, the end of the beginning. And these two talks were given by a very distinguished British ambassador, the former ambassador to Russia for something like 15 years, and an eminent US historian, Anne Applebaum, about the current situation in Russia and what the invasion of Ukraine means. And it was incredibly salutary and moving at the same time. Two elements of that. One was the British ambassador said this is now widely known, and maybe it's not widely known because the news cycle is so short and people have forgotten it, is that before the war, US and British intelligence were able to obtain lists of the entire leadership at every level that the Russians had of the Ukrainian society, that they were planning to decapitate as part of their rapid invasion starting on February the 24th, 2022. And they circulated that to the Ukrainian leadership because it showed that this wasn't what is now being called by some people as sort of something of like a territorial dispute. This was, in as Anne Applebaum called it, a Stalinist NKVD type model where a country is entirely eradicated in a very short period of time. And that included all of the civil structure, all of the healthcare structure, all of any element that made Ukraine essentially Ukraine, having a president in Vladimir Putin who decided that that country no longer had a right to exist. Now that piece of information is sitting out there. Anne Applebaum, on the other hand, is working on the other side with people like Alexandra Matvichuk, documenting what is actually going on in occupied Ukraine at the moment. And it is the Stalinist NKVD model, the decapitation of all leadership structures in the occupied territories, the dispersal of those populations, including the children, to other parts of Russia, of Greater Russia. And the truth is that if you heard that 50 or 60 years ago, you might go, well, that's Stalin for you. Well, we're in 2023. It's an absolutely horrifying pair of pieces of information to juggle with, but it demands action now, and hence our effort here in our limited way to effect a rebuilding, restoration, repairing of the Ukrainian healthcare system. And I'm sitting here with entirely inspiring and courageous physicians from Ukraine, and Nelia Melnichuk, who is a wonderful Ukrainian-American physician surgeon here, who have the courage to do all of those things: repair, restore, rebuild, restructure a healthcare system at a time of war. And it's been a deeply inspiring process to work with those physicians. So with no further ado, I'm going to introduce Nelia, and then we can get the panel going here. Nelia.
Perfect. Thank you, Mark, and thank you for everybody coming here and listening to our stories and hearing more about Ukraine and supporting Ukraine. A little bit about the organization that I lead. In addition to being surgeon at Brigham and Women's, you already heard that we started with my husband, an organization called Global Medical Knowledge Alliance, which we started way before the war with the mission to improve cancer care in Ukraine. I'm a cancer surgeon. I see a lot of patients with cancer here in the United States and treat them, and that was one way for me to contribute back to Ukraine and help them with cancer care. But when the big war, now we're calling this big war, full-scale invasion of Ukraine has started last year in February of 2022, we quickly had to expand what we're doing for Ukraine and expanded our educational opportunities to help with education on trauma. Started supplying medical and surgical supplies to hospitals and physicians in Ukraine. Worked on providing, we were approached to provide observership opportunities for physicians in Ukraine, and also continuing supporting patients with cancer in Ukraine. And we're actually very, very grateful that we don't have to do this alone. We have organizations like HUG, people like Mark and Jackie and Jane, and physicians from Harvard University, from Brigham and Women's, Mass General, hosts who are hosting our observers here, who are supporting in any way you can. I think we were all in this, I think majority of people were in this audience, in this auditorium a month ago when Alexandra Matvichuk was here, who was, and a question was asked of how can we people of Boston support Ukraine and the population of Ukraine, and her answer was, you all know better, and some of you are already doing it, so we are very, very grateful for that. And I'll start with introducing our physicians from Ukraine, and then we can start our session. So the first one is Arkady Vodyanek. He's infectious disease physician from Kyiv. He's working for WHO in Ukraine and working on antibiotic stewardship. He's spending his 6 weeks at Mass General Hospital in infectious disease department at Mass General, organized by Mark. Our next physician is Sofia Hrychuk, who is a psychiatrist from Lviv, which is a city in the west part of Ukraine. She's spending her time at the Brigham, learning about consultations in psychiatry from Polina Teslyar, who is one of her mentors. Our next physician is Vadim Vus, who is a family medicine physician from a rural area in Ukraine, also west part of Ukraine. He is a leader of point-of-care ultrasound training in Ukraine, which is very, very needed, both for civilian population and for the population at the front lines. And he is at Mass General doing a variety of rotations through different departments, learning different skills that he needs to learn. And the next physician we have Ali Jamilov, who is finished surgical residency in Ukraine, and here doing research fellowship with us at Center for Surgery and Public Health at the Brigham, learning global health and implementation science, and hopefully he'll bring those skills back to Ukraine. And last but not least is Inessa Huivanyuk, who is a surgical oncologist from National Cancer Institute in Kyiv, who is interested in hepatobiliary and colorectal malignancy. She's spending her time both at the Brigham and Mass General in the Department of Surgery, learning the operations, but also learning how to improve quality of care for patients in Ukraine, and specifically enhanced recovery pathway that will allow patients to get better care and also be discharged to home faster, so that will free up hospital system to other patients, given the system is overwhelmed. So thank you all, and thank you all of you for being here and answering our questions.
I was going to ask the panel just to start off, maybe Arkady first, and then running down the panel, just to give your impressions of where Ukraine is now with regards to the challenges it faces with regards to healthcare and what you see are the needs that people here can provide in terms of help.
Yeah, thank you very much for the question, and good afternoon, and really appreciate and I'm glad to be here. I think it's very hard to describe the impact of the war to the healthcare just because it's so broad and there are so many aspects of this. So I will try to bring one of the examples of prevalence of healthcare-associated infections in Ukrainian hospitals and show how the war impacted healthcare, talking about this as an example. So before the war in 2021, we, as the WHO, together with the Ministry of Health, did an assessment and point prevalence survey of healthcare-associated infections in Ukrainian hospitals. And at that time, the prevalence of these infections were 5.7%, which means that out of 100 patients in the hospital, around 6 patients will have healthcare-associated infections during their stay. In 2022, we decided to make a national point prevalence survey covering a lot of healthcare facilities in Ukraine. And interestingly, we decided, before doing this point prevalence survey, we decided to do the big training for all of those who will do this point prevalence survey. And the training was scheduled for 20th and 24th of February in Kyiv. And we invited 80 people who will run this survey to Kyiv for the 4 days training. And on Sunday before the training, there were announcements from authorities of many countries, including President of the United States, that the war in Ukraine will be inevitable and it will happen soon. And on Sunday, I was not very comfortable of having 80 people in Kyiv as organizer of this conference. So I called the logisticians and said that actually we will be able to shorten our training from 4 days to 2.5, and let's do like this. So they were not very happy that they need to reschedule all the train tickets, etc. But we did the training for 2.5 days. We ended it on Wednesday afternoon, and all people left Kyiv. And on Thursday, 4 a.m., at 4 a.m., the war started. And I woke up from sounds of the explosions and also a lot of SMS, and my first thought was that I'm a very lucky person that all of those 80 people now either at home or traveling home, and they are not stuck in Kyiv and not calling and asking what they should do. So as you understand, we were not able to conduct the national point prevalence survey in 2022, but we did the point prevalence survey in 2 healthcare facilities, which in December last year, which admit a lot of patients with wounds, and we have a lot of patients that have wounds as a result of the war. And the point prevalence of healthcare-associated infections in these hospitals was 14% in one and 28% in another one, which is like 1/3 of patients receive one of the healthcare-associated infections during their stay because of the volume of patients, volume of work, etc. So this is the impact of the war in numbers, like from 5% to almost 30%. And just I would like to finish with that during last year, during the travels around Ukraine, I met several of the participants of those training that we did in February. And they said to me that you knew when the war will start because you canceled the training for 4 days to 2.5. So please say to us when the war will end. And I said that, I didn't know when the war would start. I just was very carefully listening for a lot of people who were saying that this is inevitable. And I'm really hope that, and I also listening it now, and when I hear that United States and other countries will be with Ukraine as long as it will take to Ukraine to win, I really like to believe this, and that we will be able not only to win but also to return from this 30% to 5% and even less. And I bring this as one of the examples, but I think it's relevant for many, many aspects of healthcare.
Thanks, Arkady. Sophia, the whole other area of psychiatry and psychology, behavioral challenges.
Thanks everyone for being here. Thanks for having us in here. And I'm gonna start not as a doctor, but as a human being. So the Thursday, 24th of February, 2022, it was 3 days after my birthday. It was a little bit anxious, so I was woken up by a phone call from Kharkiv. is the city really near from Russia, and they were saying that explosions are happening in there. I thought that I woke up into a nightmare and I'm still dreaming, but it was not true. It was 6 a.m. In Lviv, explosions started a little bit later, but as a human being, as a citizen of Ukraine, as a doctor, my life divided into two parts, before and after. So we're never coming back to the before, but we have our after. So my role in here as a psychiatrist is like a little bit emotional, yeah, but we are gonna have intergenerational trauma for sure after all of this started, and we are still going through our trauma. So that's why it's hard to predict the consequences. Hopefully, with the help of our Ministry of Health, with the help of our First Lady, Olena Zelenska, who did an amazing job last year, she established the whole new mental health care program from scratch. And the best thing that has happened through the last year was her contributing to this. We created like 20 plus new mental health centers in the whole country, and 7 of them are in my city, in Lviv, because lots of people have moved from the east of Ukraine to the relatively safer west of Ukraine, and our city population grew up from 800,000 into 1 million and something. So all those people require help. Sometimes it's psychological help, sometimes it's medications. So she decided that it's needed. So she, with the help of the experts, she created those mental health centers, and we are so grateful. And she is trying to reform all the inpatient psychiatry because it's hard. My hospital, regional, is the only one in the whole region, and we had trains evacuating psych patients from the east of Ukraine, and they are still living in our hospital, so we are taking care of them. And everybody's making efforts for them to feel free, to feel like home. So for us, it's really important to be integrated into general medicine for those patients, not to feel abandoned. And we've done research that said that more than 50% of Ukrainian population, which is around 40 million people, will need some psychological help. So it's common. We have to talk about it. We don't want this to stay a taboo. In Ukraine, it's developing. We are talking about this, that it can be anyone. As for myself, it's my 3rd time saying this into an audience, I have mental issues as well. It's called survival's guilt, if you know what it is. It's feeling guilty that you're alive, that you're safe, and you feel like you're not contributing enough. It's a bad thing, but if you know how to cope with that, you're going to be fine. So in here, I'm getting all the trainings, and I'm going to spread them in Ukraine for mental health workers as well, because we need help as well. So one of my branches of efforts in here is trying to bring research and help for healthcare providers. Because we talk about civilians, we talk about military, but sometimes we forget about us, healthcare workers. So thank you all for providing this amazing opportunity for us as a citizen, as a doctor, and as a human being. Thank you.
Thank you, Sophia. Vadim.
Thank you for your attention, and thank you for question. I agree with Arkady. It's impossible to describe all the system of Ukraine, but I am a family doctor, a rural family doctor, and will tell about my specialty. And the first 3 days of war, no one knows what we must do. And I meet with our local rural authority and starting to discuss how to deal in this situation. Do we have some maybe weapon to protect our village? And our authority said, yes, we have 2 rifles in our village. And I was so emotional, and I proposed maybe we broke a bridge and explode the bridge and give maybe 2 hours for our family to go in. But our authority said, no, we don't have any order from other organization. It is post-Soviet Union model, maybe we must have some order. And we start, I understand that I can't protect our village, broken bridge explodes, but my wife said you can train our territorial defense unit. And in first week, we organized 100 men and organize a territorial defense unit, provide training and basic life support, how to stop bleeding. And many people come to our rural ambulatory and gave money. One man gave me 1,000 hryvnias, and it's $25. It's so much. And I said, why you give me so much money? But he said, this money now don't have any value for us in this time. Use it what you need. In 2 days, we prepared our ambulatory for mass influx of 100 persons. But thanks God, we don't see any Russians. We prepared our team. And I'm happy that we started 5 years ago, we started reform in our healthcare from primary care, from family medicine. And in this moment, we have all equipment that we need, all ophthalmoscopes, all medicine. We need mostly training, education. And this thing I obtained there because of your program. I thank you much. And I'm not waiting come home and sharing. I exactly now sharing by my blog and starting a big discussion. Even today we started a big discussion about electronic health record. What is good in your system, what is bad, excuse me.
That's okay.
I thank you very, very much for this program, for this possibility.
Thank you. Ali.
Hi all, thank you very much for opportunity being here. Thank you very much for opportunity to learn and grow academically. I'm here mostly for research position. I'm learning how to conduct research in surgery and global health at the Brigham Center for Surgery and Public Health. Unfortunately, these techniques, how to conduct research, how to analyze that data, how to build a design of research, they're not taught well in Ukraine, and there is a lack of this education in Ukraine, unfortunately. That's why my goal is to get this knowledge and implement this in the fields in which we are working with Dr. Melnichuk. It's colorectal cancer screening in Ukraine and surgical education in Ukraine. And I believe that young generation of surgeons should get the most up-to-date information and evidence-based lectures during this war, because surgery is one of the most required specialties right now, and implementing new techniques and new methods of teaching young generation of surgeons is very, very needed. In order to do this, we of course have to understand some barriers and facilitators in this education of surgery. And we are extremely honored to publish our first paper in Annals of Surgery, which was published last week, where we describe some challenges which face Ukrainian surgical residents in the war. Also, I wanted to mention that one study conducted in the United Kingdom showed that during the last 30 years of the conflicts in 160 countries, the mortality from non-communicable disorders like diabetes, cardiovascular conditions, and cancer are 2.5 times higher than mortality from the injuries of the war. So we shouldn't think about just battlefield injuries and trauma, but also think about other aspects and other fields in medicine as well: oncology, family medicine, psychiatry, and general surgery and education. I'm extremely honored to be here. Thank you very much for all possibilities and opportunities.
Thank you, Ali. Inessa?
Hi, nice to meet you all here, and thank you for having us. So my colleagues and my friends, I believe I can say so now, they talked like a lot of these things, and I have all that messed in my head, so I don't even know where to start. But I should probably describe that our healthcare system is just in post-Soviet era. It was even before the war started. So you have lack of education, you have not standardized, no system for standardization of medical care. You have like very unorganized system of hospitals inside the Ukraine. You don't have this mentorship that you're supposed to have, especially if you're a young surgeon. So you have all that, and on top of everything, you have your war started. And then you have patients moving around the country chaotically. Buildings are destroyed, both residential and hospitals, so no documentation for you get this patient and you have zero idea what was before with his illness, what's happening now, and you don't know where to start and what actually to do. So all of that combined showed how unorganized our healthcare system is and how much help we need from abroad, from Europe, from the US. And I'm very, very grateful that you're having us here. For me, it's not that I'm just learning like clinical aspects of how to deal with patients, how to treat patients. For me, being here is more about organizing it, how to make it all work, how to make this all people on different level of their medical education and their different medical professions, how should they all be together and work as a single system? How to organize this, how to have rules that all the doctors, all the medical care providers should just keep them in mind. This standardization has to happen. The strategy of quality improvement, which does not exist in Ukraine now, and it never existed before, needs to be implemented. So the core for me to be here is to get the understanding, the idea how to organize this healthcare system like from zero. Because what we have from soft union, it's not gonna work in a normal society, in modern world. And you guys, you provide us with the knowledge, you provide us with support and help, and you give us the hope that we're not alone here and you're gonna help. And I hope and I believe we all are gonna make a huge change. So thank you for that.
That's a very important point, and maybe we could reflect that across the group first, and maybe even starting with Nelia to talk about that, because you know, the experience of the actual healthcare system that needs to be, in a way, rebuilt in a different form. It sounds like an enormously challenging task, but actually really central to what happens next in a way. So, Nelia, do you want to comment from your perspective? And then we'll run down the panel again and just get ideas on that really important point. Thank you for bringing it up, Inessa.
Yeah, no, definitely. I think that's a very, very important point, and that's kind of why we started doing the work that we were doing even before the war, focusing on cancer care, providing access to educational materials for physicians in Ukraine, for them to be able to treat the patient in a standard way that we know that works, that they don't have to reinvent the wheel. They just have to follow the protocols that are available for us here, and that was not accessible for them over there. Some of difficulty with access is actually language proficiency. A large number of Ukrainian physicians actually don't speak English and need those materials to be translated to Ukrainian language, and that's easy. We can do that. We have them. We can translate and provide them open access, and that's what we were focusing before the war. And now we can expand on that, as I think majority of our physicians brought up is learning how the system work and learning. There are many low-hanging fruits that you don't need Da Vinci robot to do some very difficult operation. There are like very little things that we can fix and create huge impact, even with antibiotics resistance and hospital infections, post-operative care, care of psychiatric patients, care of just regular patients in your ambulatories, in your clinics, bringing research back to Ukraine. So there's a lot that can be done by us here, and some of the things that it seems like so easy for us, but if we are able to help Ukraine standardize and bring those concepts of quality improvement back, it would be huge. But I'll turn to Arkady.
Yeah, thank you very much. And talking about the health systems in Ukraine, I think it's important to understand the impact that current war has on the health systems. And I will bring some few numbers just to understand what impact it has on the service delivery side at least. So according to the Ministry of Health, 1,200 healthcare facilities in Ukraine are damaged to some extent, and 175 hospitals are destroyed in a way that they cannot be rebuilt. I mean, they should be rebuilt, so they cannot be renovated. World Health Organization also has its own, and as a part of the UN, mechanism on how to validate the attacks on health. And currently 820 attacks on health were validated by UN, which includes all of those damages that Ministry of Health counts, but also attacks on the ambulances and other healthcare providers. So impact is huge, but what I think is also important to mention that Ukrainian health system was resilient enough to maintain services and provide healthcare despite all of these challenges. And I think one of the key reasons for this was that the governance of healthcare and institutions were preserved. So each healthcare provider in Ukraine receives its salary. He or she received it in February, in March, and throughout the year, as well as medications are procured using the state budget, and all other parts of health system are still functioning. And I think in case this governance will be or would be some interrupted previously, then it would have much bigger impact on access to care rather than only destruction of healthcare facilities. I think my third point is that conflict in Ukraine is rather unique in a way that this is first time after Second World War when such a developed country face such a big devastation. And for example, WHO as an organization, we face the issue that we do not have a lot of advice on how to maintain water and sanitation services in the country which are highly developed and has these services. So we have a lot of advice how to preserve water and sanitation services in the low and middle income countries, but for high income countries we do not have a good advice. And I think there is no ready solutions for how to support the best healthcare facility in Ukraine, just because we do not have any examples of such impact on the so developed healthcare system. And the last point, I think, what I would like to mention, that before going here, I read a report that was written by USAID, World Bank, and WHO on the considerations and recommendations how to support restructuring of healthcare system in Ukraine. And a very big part of this document is dedicated to the rebuilding of healthcare facilities itself, another part on how to maintain the financial support and the system itself. But very limited part of this document is about how to improve the healthcare resources for healthcare, human resources for healthcare, how to ensure that all of those doctors and nurses who left the country because of many, many reasons will return, and how they will work in all of those facilities that are now damaged, etc. So I think in case this will be fixed, in other areas will be not so hard to fix.
Yeah, the things you mentioned there are really extremely important. Sophia, from a state level with regards to psychiatric services, is there any state organization that is watching the sort of issues that you're talking about, both helping the healers and helping the patients? Is there a national effort that can be effective in this? We are
slowly going there. I want to boast a little bit. I've been working in psychiatry for 6 years now, and we are slowly progressing towards modern psychiatry from post-Soviet one into modern volunteer psychiatry, which is the best part of it. And we are slowly developing and going there. The only thing is that most of doctors in Ukraine, psychiatrists, don't speak English, so it's harder for them to follow the instructions, the guidelines, because from 2019 we were allowed to use any guidelines, like NICE, any guidelines from Europe or or the US. The only thing is they have to be adapted into Ukrainian so the doctors can actually use it. But we're going there, we're developing, we are trying to follow up the whole world. In clinical trial, I work in clinical trials in Ukraine as well. We're going into the world statistics, and Ukrainian data is one of the best one after the United States. So our data is reliable, it's good. So we are following up with the world. About your question, we are trying to figure it out while I'm still here. We are networking with local professors at Brigham. I'm super thankful to Polina and all the team for that, because they've suggested some trainings and lectures for my residents, because I have 2 residents myself. They both speak English, so it will be easier for us to communicate, and they can bring the knowledge into their little network. So we're gonna try to create the best network of sharing knowledge from people from here, sharing their own experience, because some of those people were participating in 9/11 events, so they know everything about trauma, and they have lived through this. So their experience will be the most valuable for us, because we're in the middle of trauma now. And I don't have children myself, but I feel like even if I have them after adolescence, they will be impacted by this. And they have suggested to make research on this, on intergenerational trauma, and I feel like that is the most important part of this. So we are slowly going there, but we have to do all the efforts we can to be modern.
Yeah, I mean, there are 2 interesting sides of this, which is, on one hand, which is kind of the Russian approach that they know as part of their strategic approach, that to disrupt civilian society requires damaging the healthcare services. That's, as much a military objective as anything else. And on the other hand, those who are defending their nation realize that there's an opportunity to rebuild in a much more, durable way, the services. And this happened after the Second World War for Britain and for the US. The Veterans Administration hospitals actually pioneered all sorts of new surgical approaches to reconstructive surgery, probably some of the first understandings of things like post-traumatic stress occurred actually after the First World War. So there are all sorts of things that build resilience into the system. Vadim, in the rural setting, how is that affecting you? How are you bringing things forward? I always marvel at, like, we were on a call recently with Lincoln Labs, which is one of the preeminent defense labs in the country that are developing AI-guided ultrasound, which would allow an operator to basically insert a line with a simple robotic device. And Vadim, you're on the line, and we're thinking about how we could test that and reduce it to practice in Ukraine. Do you see the potential for technologies that are developed here to really get widespread use in Ukraine at this time?
Yes, thank you for this question. And war have a negative and also a positive impact in our health system. Firstly, about psychiatry, excuse me, Sofia, but we have in Ukrainian another classification system for not ICD-10. We use in primary care ICPC-2, International Classification of Primary Care. And we use a letter P, it's a psychiatry, psychology. And maybe 4 years ago, psychiatrists don't let us to use this letter, because, not you, I understand that you are modern psychiatrists, don't let us, and said it's impossible, only psychiatrists can make a diagnosis depression and treat. But when war started, psychiatrists understand it's impossible to treat, to deal with such a huge amount of post-traumatic stress disorder, and the psychiatrists let us to make this work. It's a big plus. About ultrasound, 2 years ago we started this destructive innovation in our country, because academic society said it's impossible that family doctor teach other family doctor of ultrasound. Only academic society can. But war changed these things. And now many of my friends and my team, I'm a chief of a POCUS ultrasound team in Ukraine. We provide training almost every 2 weeks. We provide training for military doctor, for family doctor, and also we starting provide training for nurses, for rehabilitologists. And once in one training, one military doctor said we need to train also our driver. Yeah. Because sometimes we have such a huge influx of wounded person. We need that someone else also use fast in their practice. And I am thankful for that you invite me to this group. And I want to thank you for program, because your program is not only knowledge and skills, it's beautiful contacts. And one of my mentor in this program, Tommy Hine, helped me to meet with representative of Butterfly. And we provide negotiation, and I am happy to inform you that Butterfly agreed to freeze a price for ultrasound machine for Ukrainian for lowest level. And also, we have a big problem with account, $400. It's impossible to pay for account every year. Doctor in Ukraine have only $300. And Butterfly agreed not to ask for pay for account. It's one of the beautiful things that your program help us. And about resilience that Arkady mentioned it, when we started reform, we don't think about nurse. It was our mistake when we started reform in Ministry of Health. But now in eastern region of our country, many doctors fly from this region and only nurses stay. Even today, maybe 4 hours ago, I have a conversation with USAID project, and we discuss how to broaden the competences of nurses. And your American nurses gave us beautiful example how to provide this practice. Every day we have a big discussion about system. Even today with doctors in a clinic, primary health care clinic, we discuss it, which system is better. And in every clinic, case manager, when we say goodbye, she said, "I gave you a last advice. Don't take our insurance system and don't implement in Ukraine."
Yeah, and Vadim, this is an important thing that is occurring between the sort of collaborative here, which is it's undoubtedly a really important thing, which is that we learn as much from you as you learn from us, and that there are things we've learned here about the American health service system that we definitely would definitely not want to cause to be kind of imposed in Ukraine. And besides the issues that the Everett Clinic mentioned, but it's not just the insurance industry, there is this issue, which if you're able to negotiate the price of Butterfly down to the minimum cost, this is something that the US has not been successful at doing with the pharmaceutical companies, and consequently we pay a ridiculous 10 to 20 times more for medicines that we use here than pretty much any other developed country does. Mm-hmm. And so this is an important point to take, that while we can teach you some things to do, there are also things that we can teach you definitely not to do as well. It's worth keeping one's eyes open for those. Ali, I wanted to ask you about the research you do, because, academics like us, and I, often think that we're kept in the ivory towers to avoid doing any harm to society in general, is that you're doing research is very important, colorectal cancer screening. How do you see research playing out for the benefit of Ukraine?
Thanks for the question, Dr. Poznansky. Actually, colorectal cancer burden is huge in Ukraine. Many patients diagnosed at later stages, and the war even worsened this situation because trials are interrupted, the cancer centers destroyed, patients migrated internally and externally, the same with physicians. And unfortunately, in Ukraine, there are no guidelines for colorectal cancer screening, and there are no national programs implemented for colorectal cancer screening. And right now we're doing research and discovering some barriers and facilitators among primary care physicians, and I really thank Dr. Vadim Vuz, who helped us a lot with dissemination of survey among primary care physicians in Ukraine to get this data. And we really hope that after having some analysis and conclusions and results, we think this works would be very, very needed for Ukrainian stakeholders once they will be ready and Ukraine will be ready to implement national programs into daily practice. And of course, many studies already done by Dr. Melenchuk's team on colorectal cancer screening in Ukraine, and some models analyzed the cost effectiveness of colonoscopy and other tools, and Ukraine has potential to do this, and it's just a matter of time, and we really hope that this war will push Ukraine into another level of providing care when Ukrainians united more than ever, and the whole world supports Ukraine right now.
Ernesto, you spoke very strongly about the system. Are you hopeful that a modernized system could be established in Ukraine, a modernized healthcare system?
I do believe, and me and my younger colleagues, we are deeply into that. We are studying that system. We are gathering information from healthcare system around the world, including from here. Because I personally had to face, in the very beginning, unorganized education, medical education. Then I had a challenge to get my surgical residency because the first reason was that I'm a woman and I cannot be a surgeon. So we have to change that. I think this problem exists around the world, but we are still in a very, very bad situation with that. Then you come to work at this hospital. Actually, I work at 2 clinics. One of them is private. And this is another thing that shows hope for Ukraine, because we may have both private medicine and public hospitals, and they kind of can be opponents because we have the same doctors working at 2 different places. But this patient, either at the private place, you have to pay a lot of money because very few people in Ukraine have their employers being abroad somewhere and paying for good insurance. And another thing is that people at this private place, they have better care in terms of nursing or any more simple, maybe I could say, like medical assistance. And at the government hospital, it's still a huge, huge deal. But the phenomenon is that more people want to work at the public hospital than at the private clinic, because if it's a private place, they basically try to control you, and if you work at the government place, you're more free to study what you want, to treat how you want, and to be on your own as a surgeon, I would say. But concerning like surgery and the system around Ukraine, the system is chaotic, but surgeons around Ukraine technically are good surgeons. I went to some countries in Europe, I saw them operating. I'm here for months, I see these surgeons operating. And I'm 100% positive that in terms of technical part of surgery, we are good enough. But the system needs to be changed starting from education, and I believe it's possible with the help of the world, because now we have a lot of free resources providing us with different knowledge, not only the surgery itself, but everything that happens around. And I think standardization has to be implemented. That's the core to improve our system. And the more young people we have, the more people who know English we have, the more people who we have like traveling abroad and these kind of observerships, seeing how this can be working. This is actually not a fantastic story. It's real. You just have to put a little bit of effort and just in Ukraine, I would say, just relax about yourself and how good a surgeon you are or how good a medical care provider you are. Just relax and think about the whole system just to improve it in generally.
Nelia, if you want to take over the panel now on that note, because...
Thank you, Mark. One of the... when we were thinking about this observership programs and we were brainstorming kind of who should come here, what they need to learn, we did form scientific advisory board and asked Ukrainian physicians and Ministry of Health and leaders of the hospital, what are the skills needed in Ukraine, what can we help with? And as you see, our panel is very broad. We have physicians from many different specialties, and also, as you see, the need is huge. There is a lot of things that can be improved or rebuilt, but kind of one concept in our head, we don't want to just teach these 5 physicians. We want them to bring the skills and knowledge that they learned here back and teach others in Ukraine. We want to make sure that our program is sustainable that way. And obviously, we will work with Brigham and MGH and Harvard to be able to bring more physicians here and to expand this program and to be more sustainable. But the question that I have for all of you, and I'll start with Arkady, kind of what, and some of you discussed that already, but what are the most important things that you learned here? How are you going to bring that back to Ukraine, and how are you going to teach others in Ukraine the things that you learned here?
Thank you very much, Nelia. I think that talking about antimicrobial stewardship and infection prevention control programs, which I have been observing here, I should say that those interventions and those approaches which are implemented in Massachusetts General Hospital are well known for us because they're described in the literature, they are at the guidelines, so they're not like something brand new, but I think it's always very interesting to see on how the guideline become a reality in specific hospital. And to know this pathway and also knowing that it actually took sometimes decades to get there, I think it's important to understand that sometimes we should not expect changes to happen completely during 1 year, although we should aim to implement these changes as soon as possible. In infection prevention control, as well as in antimicrobial stewardship, a lot of interventions are not about the pure knowledge, but about the culture and behavior. So behavior on the prescription of antimicrobials and behavior on how you prevent infections. And I think you're all aware of the hand hygiene and mask and stuff, which become very popular during COVID, and how actually hard to change the behavior. So I think all of these kind of aspects of how culture of safety become normality in the healthcare facilities, I think this is the most important feeling, but also way how establish it is the main lessons learned for me, which I will bring to Ukraine and will try to bring to Ukrainian healthcare facilities. And luckily that I have some possibilities to do this as a part of my day-to-day work. So I think this very positive and good examples of how to achieve what we know that we should achieve. I think this is one of the main lessons learned.
Sophia?
My main goal in here was to learn how does the CL psychiatry works. It's consultation psychiatry, because in Ukraine, unfortunately, we are just developing and starting integrating psychiatry back into general medicine. So currently I work at one of the first psych departments inside the general hospital, and there's a high possibility that I'm going to be running the next one, so I have to know how does it work in here, what to bring and what not to bring back home for it to work. And we're so proud that finally our Minister of Health allowed us to open the psychiatric department in General Hospital, because it was a tough question, whether it's ethical, whether it's okay, the safety issues, and finally we did it. We opened the department 2 years ago, and we are planning on opening the other ones. So this essential knowledge I received here, thanks to Polina and all the residents and all the fellows who were very supportive, very friendly to me, and gave me all the knowledge they could put inside of my head. And I was trying to give that to my residents as well, as I mentioned before. So we are trying to build the similar model of CL psychiatry in Ukraine, and hopefully it will be integrated as smoothly as it can be, because we want our patients to feel the same way as the other patient without the F diagnosis or the P diagnosis, whatever it's called. We want them to feel as normal as the other patients. That's my main goal in here. So I feel like I've reached all of my goals in here, but tomorrow I'm going, it's my last goal in here. I'm going into the biggest psychiatric hospital in Boston, the McLean's Hospital. It's, the Google says it's the most popular psychiatric hospital in the whole world. So I'm going to see how this works, because I work in a similar facility in Lviv. It's old, asylum-like, beautiful, but asylum-like hospital. So I want to compare this as well, because no matter what, shortage of staff, no money, no nothing, lots of doctors went abroad. Some of our doctors from our hospital went to war, male ones. So we were super short of staff. I had to be the head of the department I'd never been before. So I had no idea. And it was actually a psychosomatic department. The same thing I was learning how to work in here, but I had to face it without any knowledge on this, because CL psychiatry does not exist in Ukraine. So anyway, we had no money, no nothing, no medicine, no electricity. We still worked in magical ways, no idea. So we are exchanging experience, and I'm trying to bring this point up, that no matter what, Ukrainians are super resilient, we are superhumans, and we've opened a superhuman rehabilitation center in Ukraine, in Lviv, so we are superhumans. So one of my other goals is exchanging the experience with people from here. Well, I don't want to say more privileged, but you have more resources, educational, humanitarian resources, and money, of course. But this exchanging of experience is, it became even more important for me than bringing the CL psychiatry, because we are still working. We still exist. We still treat our patient. So, yeah, that's my second goal. I feel like I've established everything, but I'm going to McLean's tomorrow. If anyone wants an update on this, I can update this info for you, because I'm super thrilled about this. Thanks for the question.
Excuse me, I don't like so broad question. It's difficult to answer, and when someone asks me, many of my subscribers on Facebook ask me what I bring from Boston. Firstly, physically, my friends and the hosts, Garen and Christina Stone, and the Church 7 Hill bought tourniquet and other tactical equipment. And also my friend Andriy Liteply bought some tourniquets. It's physical, and I bring back to our territorial defense unit and to our soldiers from our village. Second, it's a knowledge. Andriy Liteply showed me it's possible to make ultrasound or sinuses. No one in Ukraine provides such technique, and I wrote this in my blog, and many of my friends ask me, how could you provide it? It's simple. It's simple. Also, I provide some time in a wound clinic, and they show some modern material, not gauze, but silicone, hydrocolloid, hydrogel, alginate, different others. And I started to share this. And also, more important, maybe it's a contact with the butterfly representative. I like it very much, and I don't stop it. We only started, and maybe in this third day in my rotation in emergency room, I observe work of paramedics, how he work with ultrasound and try to find some vein. And in a moment, door open it and some big equipment come in this room. And I asked, what is this? And he said, it's a portable MRI. Portable MRI? 2 years ago, we started discuss, is it possible to use portable ultrasound in Ukraine, and you have a portable MRI? Some of our doctors ask you, don't teach us for future medicine, teach us for medicine that we have in Ukraine. I not agree. Yeah. I want that you give us this dream, and I bring this dream home. Thank you.
Ali?
Yes, I really hope to bring some academic medical knowledge to Ukraine and also improve cancer care as well, especially colorectal cancer screening, which is preventable disease if it's diagnosed early. We are working actively with patient organizations and with stakeholders in Ukrainian national institutes like National Cancer Institute, opinion leaders in cancer care, and we really hope that after these studies are ready, they can be useful for creating Ukrainian standardized guidelines for creating national programs for screening patients in colorectal cancer. Another thing is, I just finished my surgical residency last summer in Ukraine, and it was very challenging for a whole group because everybody had rotations in different parts at this moment when the war has started. Some group mates took care of patients under occupation, somebody joined voluntarily army, somebody stayed with state, so somebody had to relocate. And the educational system in surgery is much different than in United States. We compared it with residents here, and we compared also education in surgery in Europe, and we really hope to improve this as well, and comparing the systems, finding some strengths in United States, especially institutions like MGH and Brigham can help us to get what can be implemented in Ukraine and then work on it.
Yeah. Vanessa, before we move to questions from the audience, do you any specific things you're thinking about in this question?
Yeah, thank you. Actually, when I was coming here, I was thinking about research a lot, and I'm working in our little team on research. And I came here basically for that, but then it switched. It switched to quality improvement as we have things that can be easily implemented, and they are written in free protocols, guidelines around internet, everywhere you can find it. And you see how these very simple things, if they are done regularly, if they are controlled, they can actually improve outcomes of patients, and that's the main goal. What we want our patients to have a better medical care. So that's one thing, is quality improvement by implementing very basic, simple things which are already proven to be effective. And another thing is perioperative care, and that is much easier to do and to do better in Ukraine, because in Ukraine, if it's a surgical patient, basically who cares for this patient 24 hours a day? It's a resident or a young doctor. And I have my friends working with these patients. We're all the same age. We share all the same problems, all the same lack of knowledge. And if I bring this all stuff, books, like free paper materials, free sources on the internet, and I just tell them, this is gonna happen really quickly. Like sharing this free information is very easy, especially if it's young doctors who specifically, personally take care every day for this specific patient. Basically, you are in charge what's happening, because your senior doctor who you work with, they perform surgery, yes, but what you do every day, you see all complications the first. You make first decisions. You you understand what's happening by talking to this patient. So it's basically on us taking care and making the first decisions. And if I bring this simple knowledge and simple education resources, which are free to Ukraine, I believe we can make a very, very big difference.
Thank you very much. Well, we'll open it for questions. I see there's microphones. Questions?
Yeah, thank you. What a heroic work you're doing. I'm a fellow here at HURI and at Harvard, and I'm not a medical doctor, a sociologist. I'm interested what kind of resistances or ways of resistance you get from the state, because you mentioned all the structural problems in the healthcare industry and how healthcare system seems to be having a lot of issues, and what kind of problems in terms of the power distribution or from the state you had. One thing. Another thing was to the honorable doctor with a psychiatry background. What sort of ways or recommendations are to treat this kind of compelling traumatic experiences? What are the best practices? Because you mentioned that there are generational issues also. So what's the medical response to that in the long durée?
Who wants to take the question about the systems question then? Arkady?
Question.
Yes, Sophia?
Am I going to
Yes,
answer mine?
yeah.
Okay. Thank you for the question because it's super important for us. We are now developing guidelines for trauma care. It's slow, but we are going in there. So we are actually engaging people from abroad. Last month, our team from the First Medical Union went to Krakow for trainings for trainers, psychologists, nurses, and medical doctors who will provide those kind of trainings for civilians, for first responders, for lay people. So this is one branch of our work. And about the state, we are trying to implement more psychologists and social workers into mental health. So we are trying to share the experience with family doctors as well. And we have a program called MH-GAP. So that's psychiatrists teaching family doctors how to take care of psychiatric patients. So and of course the efforts of Olena Zelenska. She's doing an amazing job, and hopefully I'm gonna meet her in 10 days when I'm going back home and ask her a direct question, how did she come up with such a great idea? Well, because she has a large team of experts who actually implement the knowledge, and they have established the whole series of videos on resilience. If anyone's interested, I can send links to that because I've been doing research on this one. It's short videos, 2-minute videos, animated, with sign language as well, which is great. Never happened before. So it basically teaches what stress is, what it does to your brain, and what to do, like simple yoga exercises, eating, sleeping, all this basic stuff. And it's like 2-minute videos. You can get bored. I tried to get bored, but I didn't. So it's working. You concentrate for 2 minutes, that's fine. It's animated, it's fun, and it's super educational. And I'm very proud of this. And I will boast for the third time. Me in here, I was engaged into shooting videos for Ukrainians, not animated, like live action videos, being concentrated more on public mental health. And we're trying to do same stuff, but a little bit more profound for healthcare providers, how to respond to people with trauma, how to detect it, like simple detection of mental health issues. I don't want to say the disorder part because it's stigmatizing and I'm trying to avoid this. That's why I called it issues. So that's our new initiative. That's why I was doing research about what exists and what are the gaps on this. So we are trying, well, thankfully to my little team, we have a few months to develop those videos, to shoot them. And I might be a narrator of them because I'm a Ukrainian native speaker. So that's another initiative we are so proud of.
I just want to ask Arkady, how close, just to paraphrase sort of the question on, and maybe I hope I'm interpreting it correctly, it is a question you could ask any of the US doctors here, is how close is the leadership and the very structure of leadership of healthcare in Ukraine to the understanding of the problems that the healthcare workers are facing on the front line? I think that you could ask US doctors that and you'll get a variety of different questions. What's your view, both at the World Health Organization and the Ukrainian Ministry of Health, of that understanding of that gap?
Yeah, I think this the situation is different in different healthcare facilities, and but I think that a lot of efforts were done during the war, and we have very good examples where both Ministry of Health but also local authorities were trying to capacitate healthcare facilities as much as possible, so even to broaden the scope of the work of healthcare facility even more than it was before the war. And I will bring you one of the examples, is that in many cities, healthcare facilities become so-called points of resilience. This is a points where they have electricity 24/7, which is a big luxury sometimes for the cities, and can provide some essential services to population, like provide water, provide possibility to charge their phones, to warm them in the winter. So they had like dedicated special spaces to do this. So in many cities, healthcare facilities started to provide services beyond healthcare, but also be in a community center to provide support. So I think also there is another big initiative that I would like to mention, is to develop the sustainable network of healthcare facilities, so to understand what healthcare facilities are absolutely essential for provision of essential health services, so that all of the efforts would be focused on these essential healthcare facilities to maintain services wherever it takes. But if we go like to the lower levels, I think it differs from healthcare facility to healthcare facility, but we have very good and bright examples that can be taken as a role model.
Other questions? Yeah. Oh, yes.
Prior to the war, many thousands of Indian students used to go to Ukraine to get a medical degree because it was quite affordable. And unlike the American and Canadian system, wherein after high school, one could straightly go to the medical program. Now, from what I understand, recently the government of India has put a new stipulation that wherever an Indian student studies, in that country, their residency should be also be taught. So, as of now, I think the Indian students who, after getting the degree, they go back to India, face an exam, and then do 1 year residency. But with the new system, the Indian student in Ukraine, if they again come back, they must do the residency within Ukraine. Do you think the local language, because being a resident means you have to interact with the patients in the local language. Not everyone is expected to know English. Do you think that would be a problem?
That's a great question, actually. And we have some doctors from India who have to follow these rules about returning after training. Well, what is the situation for those doctors who opted to go and continue their training outside of Ukraine? Would they have to come back and complete their residency in Ukraine? Is there
Maybe 2 months ago, our friend Mikhailo Vinnytsky provided a conversation with one of the teacher in Kharkiv Medical University and touch this topic. I think that Mikhailo Vinnytsky here have answers for this question.
Yeah, good.
Hi, thank you, Vadim, for introducing me. I was actually going to ask a question, but I guess I'll answer that one. I'm currently a fellow here at HURI, but I'm from Cave Mohila Academy and have had significant amounts of contact with medical education reform. Up until February 2022, Ukraine had 63,000 medical students, foreign medical students, through the system, which was a huge business for the Ukrainian medical universities. Those students are not coming back. Simple as that. So the changes that are made in terms of the Indian framework, etc., are probably relevant to other jurisdictions other than Ukraine, because for quite a bit of time now, the what's called practical courses cannot be done online. And Ukrainian universities are, at the moment, in terms of medical universities at least, are almost 100% online. If not online, then in most cases, foreign students are not being accepted. So that is actually one of the things that bring me to my next question. Can I ask a question now?
You can. You've earned it.
Sorry, thank you. The question actually is to everybody except Vadim Vus, because I know his answer for this. So everyone else, if you don't mind. There is a lot of talk now, because of the financial difficulties that Ukrainian medical universities have faced, that they will somehow have to be either merged or moved together with classical universities in their cities. As you know, we have a separate system of medical universities and then a separate system for classical or technical universities. In other words, there will be a merger that will be financially a merger tendency that will be financially motivated. But the question actually is that there's an argument that says that a medical doctor's preparation should be done in an environment together with other students that are not going through medical preparation. In other words, philosophers, sociologists, engineers, et cetera, as is done in North America. I guess my question to you is, have you seen any kind of benefit in the students that you are contacting with from Harvard Medical School? Have you seen any kind of benefit in the idea of a medical school that is in a university as opposed to something that is being separate? I'm looking for empirical support for a hypothesis.
Inessa, do you want to?
Yeah, if I may start. So, studying medicine is very, very challenging. You spend 12 of your hours every day just studying constantly. And as for me and all my colleagues, we were all in the environment of people with medical education, either being clinicians or scientists in that field. So we were all deeply involved and surrounded by the same people, same atmosphere, same jokes, same style of food, everything. So it could be a good thing to be in the environment of normal people, I would say. To see how the real world works, how people go home, not stay at the hospital or library till midnight or something like that. But on another hand, I think this way we're gonna lose people as doctors, because they're gonna see how you can have a normal life. You can sleep at home. You don't need to have night shifts after your studying at university. Personally, me, I worked at McDonald's to earn some money to stay at medical school. And I doubt that there were people like me, some in law or business school in Ukraine. So I think we can do that. It probably will have positive impact on our brain, but we're gonna lose doctors that way.
Interesting. Arkady.
Yeah, and while Ines elaborated on the social aspects of merging, I think from educational perspective, in medical universities, and I think it's universal for all of the medical universities around the country, we face the challenge of the low level of competences of those teachers and teachers who run studies for the first 3 years of education, namely biochemistry, anatomy, histology, and all of these fundamental sciences. Because many universities have a requirement that only doctors can work at these departments, and so the doctors which were maybe not very successful in their medical career, they start doing the biochemistry on histology, and you know that the quality is not very good. And classical universities, they may have a good advantage of providing a good quality of all of these fundamental subjects for the medical universities. On the other hand, you know that a lot of universities like Taras Shevchenko and others, they now open in the medical faculties without having any relation with the hospitals, or very weak relation with the hospitals. Medical universities, they establish this like linkages which are decades of history, and I think this merging can benefit both, so that to maintain these good relations with the hospitals in terms of the university clinics, etc., but also improving their level of teaching of fundamental disciplines.
But if
I just want to make sure we get more questions. Lady there in the front.
Did any of you know each other before you came here? Anyways, I was just curious. If any of you knew each other before you came to Cambridge, no?
I mean, I knew Ali before and Nella, but we were working
Okay,
together
just
online. Almost every week we met.
Okay. Well, thank you so much for coming and your bravery and commitment to what's happening right now. I'm a social worker, and I worked in the former Soviet republics after the breakup of the Soviet Union, Baltic to Black Sea, and relate to what you're saying about post-Soviet medicine. I was wondering what your view is about how rehabilitation medicine will develop given the needs, in addition to the traumatic generations of post-traumatic stress disorder, which even after post 9/11 when we worked, we had to move the psychiatry from the silos of medicine and integrate it more in people's lives and, like you said, take away the stigma. But I was interested to know how you see either politically, organizationally, or under your Department of Health and Government to develop rehabilitative medicine for the needs of people wounded in the war. The kids we're working with prosthesis, they need new ones every couple of years. How do you see that developing to deal with the people, not only the armed forces, but the individual civilians, thousands and thousands?
Nelia, do you want to talk about that?
Oh, yes, okay. Well, I'm not an expert. I'm a colorectal surgeon. I'm not even a trauma surgeon. But what I see now, there are many centers in Ukraine which are getting built or reorganized to actually address that problem. There are two in Lviv. One is called Unbroken and one is called Superhumans, where they're addressing that issue. They're helping both civilians and soldiers, especially the ones who lost limbs with the prosthesis. They are also doing it. I mean, I'm speaking as an outsider. I'm not inside the system, but it seems like they're doing it the right way. They're involving surgeons. They're involving PM&R physicians. They're involving psychiatrists and psychologists and social workers, and they're thinking about that problem in a big way. And it's probably, I mean, it's an example that it can be done even during the war, and people are thinking about it. And there was a question at the beginning, what are the issues with Ukrainian healthcare system? We have many issues with United States healthcare system, and obviously Ukraine has many issues. But what's important about Ukraine is that Ukraine was in the process of reforming their medical system, and a lot of good things have been done already. Things don't change in one day or even in 1 year, but they had a kind of a building block for that, and they're in the process of it. As we hear, education needs to change and needs to be adjusted. Residency education will need to be changed as well. But Ukrainians are thinking about that, and war is bad, and we're all suffering through that. And I also have a survival guilt, and I think that's why I'm here and talking about rehab and not about my colorectal surgery. But the war can bring benefit as well. It definitely united the society. It brought a lot of good out of people. People now thinking less about themselves, but more about what needs to be changed, what else can be improved in Ukraine. And even all of us being here and listening to the stories and being interested in those stories is just an example of that.
Other questions? Yes, gentleman there.
Thank you so much. I'm Arwal from Afghanistan. And it was when you start the presentation, I feel that 30 years before the invasion of Russia in Afghanistan. Unfortunately, I remember how it was difficult and how was people suffer from that even up to now. And unfortunately, the war was started at that time in Afghanistan till now, till today, there is conflict situation. So we are more suffering from this situation. In the things what is very useful, I think, in Ukraine, as it is now in conflict, in war situation, the two things I focus according to our experience. The first thing is, please, if you provide to all the communities, involve them and engage them in the health service, for example, to provide them first aid training for all the people, if it's possible. Because this is not the time for the academic things or reforming or research. This is the time for how to save the people, life of the people. And the second thing is psychiatric knowledge and education and working with the people. This is very important things. So just I would like to know from maybe family doctors can ask answer to this. Do you have any first aid training for the local community in Ukraine now or not? Thank you.
That's a great question. Vadim, is there generalized sort of first aid training now to everybody? I mean, all adults or even kids in schools learning about first aid?
Yes, I am personally started to provide training first aid maybe 11 years ago, but now in Ukraine we have many teams from first, it's not first Russian-Ukrainian war. First Russian-Ukrainian war started in 2015, and we have many huge beautiful team that provide training in first aid. I'm very sorry about war and the situation in Afghanistan. And I think also that our knowledge about mobile clinic that we organized, we discussed maybe 3 days ago in disaster medicine, and decide that this knowledge that and skills that we have in Ukraine, how to organize this mobile unit will be useful in different countries, in Syria, in Afghanistan, in other, to help people in the first part of the occupying of territories. Thank you for the question.
For one last question.
One last question, yeah.
First of all, I want to say thank you so much for everyone on our panel today for coming. It's been an honor to hear from you. My name is Sonia. I'm a G1 student in the RECA program. I had a quick question regarding, for Sophia and anyone else who wants to contribute to this. So you mentioned how psychiatry is being integrated back into general medicine. From the civilian perspective, has there been any resistance towards this, considering previous transgressions on the political end in psychiatry? How are civilians dealing with this in terms of stigma? What has the response been within the population?
Thanks for the question. It took us like more than 2 years of discussions with Ministry of Health, whether it's relevant, whether it's possible, whether it's ethical, and all those kind of questions. It was a tough discussion. We had like almost fights, not physical fights, but wording fights, whether it's okay for Ukrainians, are we ready for this? And I think yes. It took us 3 years. And now I've seen the perspective from being a resident to the head of the department, 6 years. So people now are more educated in psych ed. We finally admit that everybody can have mental issues, but that's fine. That's okay not to be okay, but to get the help you need. So we're finally there. We're going towards there. And we are making all the efforts to give the info for the people, even in the Ministry of Health, because most of them are not psychiatrists, and we have to develop multidisciplinary teams within the doctors at first, and then within the society. But I can compare. I work at 2 inpatient departments. One of them is psych hospital, and the other one is general hospital. And I'd say that the ones being at general hospital feel better because they don't feel stigmatized for this. They don't feel abandoned. They don't feel isolated. And that is wonderful. So we're there, finally, and I'm super thankful to Ministry of Health and she's my neighbor. She's from Lviv. And she was the most resistant to all of this. And we had fights with her But now she resigned. Maybe that's why we already have the psych department there. Yeah, so thankfully it all happened, and we're gonna open, hopefully, psychiatric departments in more general hospitals, and that's my dream come true. So we're happy. Hopefully lots of people think this way, and it's gonna be better not for us, but for the patients. Thank you again for the question.
Well, I'll say something, and maybe Nelia, you can help wrap this up, but obviously it's a great honor for us to be hearing all of your experiences here, and incredibly instructive and inspiring. I just want to thank our panel on behalf of ourselves at the Heal Ukraine group and for your participation in this. We obviously want to do this more with more Ukrainian physicians, and also exchanges so that the learning goes both ways here, because we have as much to learn from you as you have potentially to learn from us. There will be a reception after this, so there's the opportunity to meet and greet our colleagues here. We are, as Sophia, I thought, notably said, we are both doctors and humans. That's important to say.
That's super important.
And so let me just hand over to Nelia to make closing remarks here.
Thank you, Mark, and thank you, everybody, for attending. Just to kind of bring up the point that even though we are talking about all these changes that are going to happen in Ukraine or happening in Ukraine, and the opportunities that some physicians in Ukraine are having, Ukraine is paying a huge price for all of this, and it's fighting not just for Ukraine, but for the whole world, for the whole democratic world. Just want to end with that, and thank you all so much for being here and supporting Ukraine, and we hope we can do more as a Harvard community and Mass General and Brigham to be able to support Ukraine further. But thank you all for being here, and I think we have reception outside.